We do a lot of breast surgery at this facility, whether it's breast reconstruction in the breast cancer patient or enhancement procedures on the breast. And I like to call these breast enhancement procedures because even though we want to think of them as a breast augmentation or a boob job, they are procedures that we're using to enhance the patient and enhance the appearance of the patient, the confidence of the patient, and how the patient feels about how they look. We are a very breast-oriented society, and breast augmentation procedures or breast enhancement procedures are popular and they're common in every practice. In determining the good candidate for breast enhancement surgery starts with being a good candidate for anesthesia in general. Patients will have a wide array of anatomy, whether it's the breast that is kind of on the droopy side, or maybe one breast is large and the other breast is not fully developed, or whether the patients may not have really had enough breast volume to fill in their swimwear, to fill in their evening wear, and give them confidence in their swimwear and evening wear. Those would really be the best candidates for that procedure, those patients in which we can make a positive outcome in those areas. This office has access to every FDA-approved breast implant in this country, whether it's a saline breast implant with a silicone shell, or a silicone implant, whether it's the newest generation or some of the previous generation. We also have access to the different shells on the implants, and we make those decisions very carefully with the patient as to what the proper implant material is and what the proper implant shell is. We always recommend that patients undergo as much education as they can, not only about the type of implants that a practice has access to, but also a full complement of procedures that a patient has access to. You also need to have confidence that that surgeon does enough breast surgery to understand what his own or her own shortcomings might be. In this office, we have a full discussion regarding what we can use as an outcome measure and what we don't use as an outcome measure. For example, patients often come in and say, I want to be a C cup or I want to be a D cup. In this office, we don't use cup size as a gauge for success. There's no standardization in cup sizes, and so that's not a great gauge for success. In looking for success in our patients, we start with using a tight garment and stuffing the brassiere with different size implants and having the patients look in the mirror and feel and understand what they like or dislike about that volume. You really have to have capabilities as a surgeon to be on the same wavelength or the same page as the patient as to what they want as an outcome. All of that kind of comes into selecting the right surgeon is one that would work with you as a patient on helping determine what the proper implant is and what the proper implant volume is. The length of the procedure for breast augmentation, for the typical breast augmentation, is one of the shorter operations that is done. There is some prep time ahead of time, there is some recovery time thereafter. The surgical time in and of itself, the actual surgery time is typically inside an hour. Recovery from breast augmentation again depends upon what we're trying to recover to. From a pain standpoint, very doable, a couple of days of the stronger pain medications, if those, and then back to work in 4 or 5 days